Good morning. At Kaiser Permanente, with this theme called Thrive, and so I'm used to at least trying to show energy. Good morning. No, it's really an honor to be here with you on this morning and to spend a few minutes with you on a topic that's near and dear to my heart and the members of Kaiser Permanente, especially at this critical time in our country around transforming health and healthcare in the 21st century. It is also an honor to be here, and I think everyone has seen the fires going on in California. We are based in California, and that is one of my hospitals that we had to evacuate that they keep showing across the nation. We had about 134 patients in one of our hospitals, and the fire was literally across the road from our hospital. It is still in a danger zone, but most importantly, we got all of our patients and staff out safely with that fast moving fire. So I want to spend a few minutes that I have with you setting up a theme. And the theme is around healthcare today. Healthcare today is on our collective watch. We're in charge. And the question is, how will what we do today be judged by the future generations tomorrow? A half a century from now, a century from now, and going forward. Just a little bit about Kaiser Permanente, great mission over 70 plus years. We stand on a couple of critical cornerstones. One is a belief that high quality, affordable care should be made available and accessible to everyone. So we focus at Kaiser Permanente on the highest quality care possible at an affordable price. And that our target, our shareholders, are the members who belong to Kaiser Permanente. And today we have 11.8 million members who belong directly to Kaiser Permanente. We're just under 12 million. We're right about 12 million. I hope we have 12 million by the end of this year. My legal staff always remind me that I cannot say 12 million until we have 12 million. So please, for the record, almost 12 million members that we have around the country. But we also have, within the communities of Kaiser Permanente, 65 million who are in the communities who are also in the line of sight of Kaiser Permanente. Directly on my management team is a leader called the Chief Community Health Officer, and his job is to sit on my leadership team and represent the interests of the 65 million citizens that live in the communities in which Kaiser Permanente exists, because we believe that we're part of a whole ecosystem of health in our country. As you heard earlier, we're a mega health system, over $70 billion this year projected in revenue, just under 12 million members. We have 207,000 employees, and in our Permanente medical groups, we have over 22,000 physicians. We own and operate 39 hospitals. We buy about $5 billion of hospital services on the market. And yes, we pay over $1 billion for our hospitals. In some of our markets, we just opened a new San Diego hospital. It was $1.3 billion. I'm still trying to digest the fact that it's $1.3 billion. Over 600 medical centers, and we do a lot of work. We touch the lives of millions. You can see some of the statistics just to lay a foundation. Almost 130,000 inpatient procedures, 44 million doctor office visits. We do 1 million mammograms a year. We bring into the world, we assist moms bringing into the world over 106,000 babies a year. I used to say we bring into the world 106,000 babies a year. I ran into a mother who actually brought in a baby, and she said, "Don't ever say that. You have nothing to do with the pain and suffering. You simply assist us in bringing the babies." So we don't bring the babies into the world. We assist the great moms. We're a totally integrated delivery system. We focus on two things. We focus on care and we focus on coverage. We're integrated, and so we own the dollar, as I call it. We provide, through our health plan, the contractual oversight on behalf of the almost 12 million members. We provide our services to the government. We provide it to employers. We to individuals. And then we work together as a totally integrated system. So that's the background to lay my foundation of going forward. The future of healthcare is on our collective watch. I would say that as I have participated in the debates in our country and actually represented us outside of the country, I am clear, and I think you are clear, that when you think about our collective challenge, it falls into this parameter that has to do with access to coverage and access to care. And as I've been saying, there is a difference because there are millions of Americans who have access to affordable coverage plans that gives you coverage, which is the key to the front door of the American system, but it doesn't necessarily mean it's going to be affordable for you to get care. Access to coverage, access to care. Providing affordable, accessible, high-quality health and health care for millions more is the collective challenge that we have in front of us. The debates that we're having in our country today is going to guarantee that the health system that we're all a part of and is on our collective watch is going to be dramatically different 5, 10, 15 years from now. The idea that the existing healthcare system as we know it today will survive and thrive, for anyone who believes that, if I had more time, I'll paint the evidence of why that is not a value proposition that we should collectively be holding on to. If you believe going forward with the forces that are being placed on the healthcare industry, rightfully so, that we can continue to exist without good data, without good information, without interconnectedness, without fundamentally changing the whole financing of the healthcare industry, anyone who is still believing that fee-for-service is going to survive in our future, you should really start looking at the dynamics of every other industry that has changed dramatically and is being proven now that in many cases healthcare is no different than some of the other industries and some of the behaviors that goes on within those industries. So I like to frame it like this. We are pretty clear that we have decided as a country that it's going to be our collective obligation to take care of two classes of people, the elderly and the poor. A lot of people do not give the credit to one of our late presidents, President Johnson, who really drove this bigger society vision at an opportune time in our country. And during that time, one of the many things that was passed was the Medicare and Medicaid amendments of the Social Security Act, in which we as a country said we're going to provide care and coverage for the poor, and we're going to provide it for the elderly. And during that time, the definition of the poor was very different then than it is now. And just like during that time, the life expectancy of the elderly was very different then than it was now. So fast forward into the 21st century. The most significant piece of law and legislation that has passed over that 50 plus years now has been the Affordable Care Act. And whether or not we keep it or go with something else, we have to come to terms with the redefinition of how we think about the poor as an evolving reality in our country. I have been arguing that when we settle the issue on how we're going to deal with the poor and the working poor, the next issue we have to deal with is how we're going to deal with Medicare in the future. Because now, thankfully, because of many of you and many in the industry and just the advances in lifestyle, people are living well beyond 60 and 65. They're living 80, 85, 90, and soon it's going to be a norm that people will live 100 and above. So we have the issue yet to deal with, how we're going to take care of this segment of the population. So in our country today, almost 150 so million Americans are covered by employer-based coverage. About 70 million are covered through Medicaid. About 60 million are covered through Medicare. About 20 million are covered through the Affordable Care Act. And 30 million are still uninsured. Still have work to do. That's going to continue to put pressure points on every one of us in this room. The majority of the healthcare dollars are still spent towards the latter parts of a person's life. A fix-me system still exists today. That we go out and do things happen to our bodies, and the medical industry, by and large, is still geared towards fixing problems when they happen. And the fact of the matter is, in this country, still the majority of the dollars are spent towards the latter ends of a person's life. I believe strongly that in the future, we're going to continue to see a shift where the economics of healthcare will continue to change, and the expected value proposition will be in what I call maximizing the healthy life years of individuals. And how do we invest differently in the healthcare industry, where prevention, early detection, early diagnosis, early treatment becomes the invested, resources that extends the healthy and maximizes the healthy life years, and that we continue to focus on the concentration for episodic care and ongoing maintenance of care in high related systems and reliable systems like Kaiser Permanente and other integrated systems that looks at the systems of healthcare, not the individual necessarily, just episodic based care that still permeates the healthcare industry in this country. We can demonstrate now that our, quote, patients also behaves like consumers. Kaiser Permanente, we invest billions every year on our technology platform. If I was building Kaiser Permanente from scratch today, I will start with technology and then build everything else. The fact of the matter is, the healthcare industry started with hospitals, and everything was built around hospitals. Everything evolved around hospitals. We train millions of people to come to us. And I used to say, and we did it at the times that were most convenient to us, unless you had to be hospitalized. Kaiser Permanente now have this strategy called Care Anywhere, which says that with the iPhone, with the iPad, with the computer, with a relationship with your personal physician, you have new access points to get care anywhere. And the real incentive is to make sure that the physicians are not disincented or incented to apply their touch and their expertise into any environment that makes the most sense for the care that that person needs. So here's how I think about it at Kaiser Permanente. This represents all the access points that 12 million, almost 12 million members have, and the 65 million that we take care in communities around our Kaiser Permanente territories have. So the idea that the hospital is the center point is no longer the psyche inside of Kaiser Permanente. The access point of hospital is one very important, one critical place when one needs high-intensity care in that kind of environment. It is where we do our magic. It is where our physicians excel in some of the best outcomes in the nation. But there are many other access points inside of Kaiser Permanente as well. Fact of the matter is, the majority of our interactions with our physicians now is handled through the use of technology. Members being able to say, I have a choice. Do I think I need a physical visit, or can it be handled on the phone, or do I want a video conference? And because of that relationship with the physician, and the physician having all of the information in front of him or her, together they can make the best decision in the best interest of that member. This is to give you an example of some of the incredible numbers being produced through technology at Kaiser Permanente. On our kp.org, which is our center landing platform for all things being Kaiser Permanente technology, we have almost 250 million visits a year to that one system at Kaiser Permanente. Over 24 million secure e-visits are done between the member and the patient. 45 million lab tests are viewed online. 85,000 video conferences are performed. Over 22 million prescriptions are filled. And we obviously have technology permeating our neurology care and programs in our centers of excellence strategically located around the country for Kaiser Permanente. I want to add something. I belong to the World Economic Forum, in which we've been spending a lot of time talking about this notion of the fourth industrial revolution. And the fourth industrial revolution is what is believed to be the next wave of how digital and sensors will become the new norm for setting up new infrastructure for big organizations going forward. Think B&B. Think Uber. Think organizations who have built market value not based on assets like we all grew up thinking about. Kaiser Permanente, billions of dollars in physical plants. GM, billions of dollars in building cars and the likes. And new companies like Tesla comes along and reaps new market value because of the new business proposition that's being talked about. Airbnb don't really own physical beds and buildings, matched up against Marriott and others. And more people now stay at Airbnb than they do at many of the competitive hotel chains around the nation. Whole new mindsets are being created around the centerpiece of digital technology and sensors, being able to monitor people in new ways that have never been thought of before. It's going to disrupt how we think about our world as we go forward. There's been a debate going on that I keep hearing, which is, will technology replace people? Do we really need doctors in the future? Will robots do everything? And I've been very clear that I stand on the other side of the debate. That in Kaiser Permanente, technology is not there with the notion that I want to replace doctors, I want to replace jobs. Because I believe strongly that technology augments, it supports, it complements. And healthcare will always be a people-to-people equation, because the touch is still the most critical thing that happens in the most vulnerable time that a person is dealing with the most delicate issue, his or her health. And the idea that I'm going to have a robot to go in at that time to consolate a patient is not in my vision for the future of healthcare in this great country. But technology will definitely change dramatically how we think about our collective work as we go forward. And all of us will have to own that together as we help to shape the future of healthcare. The final two slides, the final slide I want to share with you is something that we just did at Kaiser Permanente because we are going through such major transformation. and I'm excited about it. I'm excited about the challenges. I'm excited about the opportunities, but I'm also humbled by how massive the hills are that we have to climb in this healthcare industry, in this country, in which millions of innocent people put their trust and confidence in organizations like Kaiser Permanente and in individuals like you in this room. So we put together what we call our 4 beliefs. Our 4 beliefs is simply to reaffirm to our nation in the context of what we call a shared agenda, and to reaffirm to every employee at Kaiser Permanente and every physician who practices every single day in the walls of Kaiser Permanente that no matter how dramatically we change and no matter what kind of future we go into together, there are 4 beliefs that we will always stay true to. The first one is the belief that life, liberty, and the pursuit of happiness requires total health, and that includes equal access to high-quality health care for all. And we talk about this every single day. Until we change, and I don't think we will in our lifetime, that you have to have the key to the front door to get to the right healthcare system. Everybody should have access to that as they pursue their life dreams. We believe that health is more than freedom from physical affliction. It's about the mind, it's about the body, and it's about the spirit. We believe that health care must be affordable for all because thriving individuals, families, and communities require that. And we believe in a healthy and engaged life with good beginnings and dignified endings. And finally, one of the initiatives that we are now working on at Kaiser Permanente is what I call the reconnection of the head to the body, mental health. How do we redesign mental health in our nation? How do we collectively deal with the fact that we're living under stresses today that we've never witnessed in our lifetime? Do we accept that the jailhouse is the mental hospital in many of our communities around the country? Do we accept that it's okay when we see all the tragic situations that the first thing we go to is, this person was suffering from a mental problem? Do we accept in our workforces that individuals are committing themselves to taking care of others while they themselves are dealing with major issues? And so at Kaiser Permanente, we have now focused on the whole initiative of bringing our resources and talents and collective thought processes together and really focusing on mental health care. And one aspect of what we're doing is beginning to drive a public awareness announcement that gets people to talk about it. And we call it Find Your Words. So we've committed multi-million dollars to an advertising approach that is centered around one theme: find your words, to get people to start talking about it. Underneath it is to begin to get rid of the stigma around mental health so we can treat mental health just like we would heart disease, brain disease, any other issues that we're dealing with in the healthcare industry. I want to end on showing you the latest commercial that we are running, and we started this on yesterday on Find Your Words. Thank you very much.